Welcome to SIBO. No, it's not the Lion King. Okay, so when we look at this small intestinal bacteria overgrowth, okay, we're getting so many different comments, okay, on YouTube and around to have people ask for specific diseases. And the tough part, you're going to see the same solution, okay, for a lot of different diseases and conditions. And when we do a talk like this, you're going to see, like, some people say, well, irritable bowel syndrome is totally different than Crohn's, which is totally different than ulcerative colitis, but the solution is the same. And the causes are pretty darn close to the same. Okay, so when we look at this, according to the Journal of Gastroenterology and Hepatology, we're looking at small intestinal bacterial overgrowth, SIBO, defined as excessive bacteria in the small intestine, remains a poorly understood disease. Initially, it was thought to occur only in a small number of patients. It is now apparent that this disorder is more prevalent than previously thought. So how do you know you have it? Well, let's look at the symptoms. I mean, now look at this, because when you look at this, think of the body as being intelligent. Okay, we got nausea, bloating, vomiting, and diarrhea. So that means something is not right in the intestinal tract. It's either your body is trying to get rid of it from either end. Bloating, so that means possibly slow gastric motility. And we're going to go over how the intestinal tract works. Malnutrition means that your body is not being able to break down the nutrients. Weight loss, joint pain, that means that if the joint starts to hurt, it means the blood isn't healthy, so you can't get healthy synovial fluid production. Fatigue, that means low nutrient production. Rashes, acne, eczema, those are all the body trying to use the skin as a detoxicant. So it means that the system is being poisoned. Depression, that means low serotonin production. Rosacea, it's redness of the skin, again, a detoxing response. So just looking at the symptoms, we know what's going wrong. Okay, well, I mean, real doctors do. Okay, now, you're looking, prevalence rates of SIBO in young and middle age appears to be low. So it means that something has to happen later on, although the young people they're getting it on the rise. Okay, consistently in older patients, the overall prevalence of SIBO in the general public is unknown. In general, SIBO is substantially underdiagnosed because it's very difficult to diagnose a bacterial overgrowth. Now, if you have this, okay, abnormal bacteria in the small intestine, it's going to predispose you to a number of other conditions. And we're talking like irritable bowel, celiac, cirrhosis of the liver, lactose problems, morbidly obese, diabetes, motility disorders, pancreatitis. Now, what are some of the complications? And again, I'm just running through the facts here and the stats, and this is out of that big book, okay, that if you're utilizing medical care for health, which we really don't recommend because they are the leading causes of death in America, okay, well, it's true, okay, but this is the book that they use, okay, and everybody, once you have this category, or you're labeled, okay, with harlot or adulterer or SIBO, okay, you're set up for certain, therapies. Well, complications, malnutrition, vitamin B deficiency, interesting, B12. So when you look at that, isn't that made or processed, but you need intrinsic factor from the stomach? So this, again, it's all the intestinal tract. Anemia, poor fat absorption, so that means that perhaps the duodenum isn't working right or the gallbladder isn't working right. Kidney stones, damage to the intestinal lining. Now, it's interesting, when we look at this, SIBO develops when the normal homeostatic mechanisms that control enteric bacterial populations are disrupted. Okay, I'm going to stop there just for a second. So the small intestinal bacteria overgrowth are from a disruption of the normal bacteria that's there. You should be saying, duh. Okay, two processes that are most commonly predisposed to bacterial overgrowth are diminished: gastric acid secretions and small intestinal dysmotility. Now, what that means is that when you eat something, you're going to produce an acid, and that acid it's got digestive aspects to it, where it does break down food, but it also kills pathogenic bacteria, and it does reduce bacteria. And also small intestinal dysmotility, there is a peristaltic wave, a wave that pushes food down through the entire digestive tract, and so that's altered. So now when we look at this, we're looking at low gastric acid secretion and a slowing of the motility. And it's interesting too, because when you read something, and this is out of the big book that the leading cause of death, that if you utilize them for medical care that you're going to go to, that big book, okay, and they're looking at this and they're saying, well, we don't really know what causes it. And then all of a sudden, we know what causes it, okay? Now, gastric acid, it suppresses the growth of ingested bacteria, limiting the number of bacteria in the intestinal tract. Now, diminished acid production, hypochlorhydria, is a risk factor for increasing it. Okay, and now this is one of the things that happens as we age. As we age, we produce less acid. This is why we start wrinkling, we start to get loose joints. If you're not taking digestive enzymes or pre-digesting your food with juicing or blending. So as we age, there's less acid secreted. And so that kind of makes sense that SIBO would occur in people that are older. It does. Now, it's interesting, Helicobacter. This one was discovered back in the late 80s, early 90s, and when I was just taking microbiology. And they used to think that the stomach is so acidic, there's no way you can find bacteria in there. Bam, they find it. Okay, now they say, hey, we got the cause of all the ulcers. Then they thought, don't, okay, it looks like it's in about half the world's population, and it's asymptomatic in about 70% of those people. And the reason they've only found it in half is because they just haven't really looked. So now they're starting to think, well, wait a second, this bacteria that we knew couldn't possibly exist, now we see it in most of the world's population. Perhaps it's normal flora. Because this Helicobacter, and helico just means like helicopter, live in the mucosal layer that covers and protects the tissue and lining of the stomach and the small intestine. So this bacteria, if it's normal flora, okay, if it's in there, and bacteria are very competitive. Okay, they always fight for the same environment. They're competitive with funguses and yeast and bacteria or other bacteria and viruses. So it's interesting. I love the American College of Gastroenterology. It's not clear how H. pylori spreads. It may be transmitted person to person by close contact, such as kissing. People may also contract H. pylori through food or water. That's weird, okay? You know, this sucker survives in stomach acid. I don't care how much tongue you're getting. I doubt if you're getting down that low, okay? Am I the only one thinking that? God, I hope not. Okay, so when we look at this, and it's interesting too, because I really think that it's affecting way bigger population, but they just haven't found it yet because it's inside the gastric mucosal. Scientists aren't sure why it affects some people and not others. Well, longer tongues. Why some people have never become infected at all. 70% of the people that get it are asymptomatic. Yeah, no kidding, okay, if it's normal. Okay, now, it's interesting. The risk of infected people developing peptic ulcer during their lifetime is 10 to 15%. The risk of gastric cancer is less than 3%. Interesting. Gastric cancer is less than 3% if you have Helicobacter. So now, what are some of the drugs? We know that as we age, we don't produce much acid. Now, if you've seen those commercials where the comedian runs, jumps his Sea-Doo over through a flaming hoop, and yeah, I got this. Now I can eat my pork rib that is undercooked and has some parasites in it, but I can take my proton pump inhibitor and be safe. Well, turns out not. Long-term administration of proton pump inhibitors, those are antacids, cause bacterial overgrowth in the stomach and duodenum. Now, it's interesting that these, and we're looking at Journal of Gastroenterology and Hepatology, these are main journals. So how can you say that we don't know what causes it? It's not clearly defined or clearly understood. I don't know. I always thought doctors had the ability to read. So when you look at this, proton pump inhibitors and a risk of gastric cancers. So it turns out, and we're going to go over the mechanism of this, but you have a muscle on top of the stomach, okay? There's a huge amount of acid inside of the stomach, and when that acid is present, that muscle on top of the stomach tightens up. So acid can't come in the esophagus where the tissue is totally different. And so if you've had reflux or GERD or any of that, they always say, oh, it's from too much acid. Okay, that's that little book that the leading cause of death in America read that have no bearing on reality. Okay, the reflux comes from too little acid. And in fact, the drugs they give to decrease the acid increases cancers of the esophagus. So the exact reason that they're prescribing this is actually causing it. Yeah. Wait do you see the research I'm doing now for polio? Oh my God. Okay, yeah. Antacids loosen the lower esophageal sphincter, causing acid to flow up the esophagus. So they literally are they're creating the mechanism that doctors know can damage the tissue. Now, now this also is gut motility, and this is just that beautiful peristaltic wave that pushes food through the entire gastrointestinal system. Normal GI motility involves a highly complex, tightly coordinated series of events designed to move material through the GI tract. During periods of fasting, a migrating motor complex develops approximately every 90 to 120 minutes to sweep residual debris through the tract. So this means you're not even thinking about it. You know, has mucus linings get off of the intestinal tract or off of the stomach, or as you swallow your saliva, there's always this beautiful wave that pushes food through, because your body is always breaking down tissue, absorbing nutrients, your gallbladder is secreting, your pancreas is secreting. Impaired gastric peristalsis, that's that movement, can lead to SIBO due to static food and bacteria in the upper GI tract. It absolutely. So what causes slow gastric motility? Well, for one, stress. Under physical, chemical, or emotional stress, blood supply, nerve supply to the gut shut down or decrease. So under stress, you got 4 times less blood flow to the GI tract, along with a change in enzymes, so low enzyme production. That means you can't break down the nutrients. You've got poor nutrient absorption. Wow, this sounds like we're getting close to the symptoms of SIBO, doesn't it? Decreased oxygenation of the gut, so that means increased toxicity. Elevated cholesterol. Why? Because that's going to be your body's requirement for cortisol, which is an anti-inflammatory. Elevated triglycerides. Decreased gut floral populations. When we talked about how the normal gut flora of the intestinal tract is decreased, stress does that. Wow. Interesting. Now, how common is stress in our society? They say 1 in 2 have moderate stress. I mean, I kind of think it's a lot higher than that. But how are these people being diagnosed? Are they misdiagnosed because under stress, blood pressure has to elevate, cholesterol has to elevate? Okay, and are they misdiagnosed with high blood pressure, high cholesterol, depression, anxiety, sleep disorders? Are those diseases or the adaptation to stress? We know this. I mean, this is you. I just did. I had a patient come in from about an hour south of here, travels in sales. Okay, and she's fine. She's fine. I don't have any problems whatsoever. Okay, and she's talking to me like this. Okay, now granted, I'm about 4 feet away during the consultation, but I'm going, "Hon, your neck is driving me crazy." She says, "Yeah, it was really bugging me a few months ago. My hands were even going numb, but then I had this epidural injection in my neck, and it's just fine." I said, "Dear, it's not fine." Okay, she's a traveling salesperson. Okay, super high stress. I'm gonna show you what fine is. So let's look at this system, how it actually works. Okay, now you've got a nose above this. That nose smells certain nutrients. And depending on what hits that olfactory bulb, that sensory organ, the brain, your body is going to start to either salivate to start to break down carbohydrates. Certain acids are going to be produced in the stomach. Okay, and those acids are going to be specific for what you're smelling. So if you're smelling broccoli, it's going to be a different acid than Brussels sprouts or carrots or lamb or beef or chicken. It's going to be totally, totally different. So, well, this works on the wall, but not on the thing. So then it goes into the stomach. And you got that muscle on top of the stomach right here called the lower esophageal sphincter. And then the stomach, that closes off, and then it gets sloshed around. Then it hits a small area called the duodenum. Okay, now the duodenum has great sensors in there. And this is where minerals are absorbed, so you need high acid to get minerals in the system. The gallbladder senses that fat in the system, so it stores and concentrates bile. Instantly, the gallbladder contracts. And then the pancreas has bicarb as well as digestive enzymes that secrete into the same area of the duodenum. So this is where fat absorption and mineral absorption takes place in the duodenum. Then it goes down further and further and further. Remember, this is everything that you eat follows this pattern. Whether it's broccoli, Brussels sprouts, carrots, anything. Okay, it's going to go through here. Does the Tylenol do that too? Yeah. Antacids do that. Yeah, the medications for high blood pressure, all the drugs and chemicals that you take actually follow the same pathway. And that's why you're going to see a lot of the medications that cause it are also disrupting that normal flora. I heard the most beautiful thing. This was by Dr. Tilden in the early 1900s. He said the inside of the intestinal tract is the outside of the body. Now think of that. Think of that. Okay, if you could, just like a cartoon, shine a light down here, and if that light could bend through the entire intestinal tract, it'd be shining out here. Am I the only one that saw that Tom and Jerry cartoon? But trust me, it could really work if we could straighten out the intestinal tract. Okay. So when you look at this, anything that we're putting in there, so it can. We do have bacteria in the entire intestinal tract, but not an overgrowth of it. Now it goes through the jejunum, then it goes through the ileum, and then it dumps into this large thing called the large intestine, into the secrum. Now there's so much bacteria in here. The way that the design feature is we have an appendix, which is a lymph tissue that produces certain things to keep the bacteria in check. I mean, what a brilliant spot to put it, and it's called the appendix. And then the food goes through, and this is where most of the water absorption takes place. And then it goes out, gets concentrated. Once all the nutrients are gone and the water's been absorbed, then it's flushed out the system. Then we run into problems like people taking an antacid, removing the gallbladder, okay, not wiping out the appendix, having high stress. You know, when I get people with all the parts, it's a lot easier to fix them. It really is. I mean, 100 years from now, you know, I mean, I'll probably only be able to do this for another 4 or 5 years before we're kicked off, because they're trying to pass laws now to make it illegal to comment on other people's work that you just read. Really? Yeah, the movie Vaxxed they're trying to make it illegal. No, you can watch porn in California, don't worry about it, but for God's sake, stay away from the movie Vaxxed.
Free speech is going to be gone.
Yeah, free speech is yeah, it's going pretty quick. Okay, now, what's your natural defense against abnormal bacteria growth in the beautiful system we have? Bacterial flora of the gastrointestinal tract is an important factor for the preservance of integrity of normal functioning humans. Absolutely. So we have a normal flora. So what protects you from SIBO? Your normal healthy gut bacteria. Now, and when you look at this, the bacteria in your system are so vital. I mean, the bacteria produce vitamins like folates, vitamin K. They have their impact on sensory and motor functions. The intestinal bacteria are influenced by a lot of different factors: composition of the food, environment, drugs, alcohol, several other factors. So let's look at some of the things, because when we're talking about SIBO, let's look at what affects it. Well, for sure, vaccinations. Okay, because those actually can cause a leaky gut. For sure, antibiotics. For sure, medications and processed foods. And now, wait a second. It can't be that simple. It is. Now, there is no human being that has ever been alive on our planet that has gone through generational exposure of these neurotoxins. This is unique in America, unique in the world. And we're seeing the result of that. Okay, we're seeing the result of the sickest population the world's ever seen. 69 doses of 16 different vaccines until you're 18. Now, no other country in the world does it. Now, mind you, when you talk to the automatons, the ones that say vaccines are safe and effective, amen, okay. Well, did you know that none of these require or have ever done a randomized controlled trial? Now, this is the gold standard. This is where you take a group of people, dividing them up into thirds. 1/3 gets a placebo, 1/3 gets a therapy, 1/3 is a control group, and you follow them for a few years. Okay, and that has never been done, ever, with vaccines. What they do is they compare one vaccine to another vaccine. There are no randomized controlled trials. There are very few animal trials, okay, and there's only one animal trial that I know of that involved all of these. Now, that was published in the Journal of Neurology, and the problem is it was pulled because it showed that every animal had a negative neurologic effect: brain damage, loss of social behavior, and you can't have anything that negatively affects the opinion of this. Now, what we're looking at, each one of these causes an inflammatory response. Every vaccine, so when you get the vaccine at 12 hours, that triggers an inflammatory response. Okay, this is 12 hours, brand new kid, just first time in the world. At 2 months, you get the diphtheria, the tetanus, the pertussis, the polio, the Hib, the rotavirus, the hepatitis B, and the POV. Okay, so you get these at month 2. Then you go back 2 months later at month 4. So now you've been on the planet for 4 months. Yes, it's time for your second round of DPT. Okay, granted, we know it sheds. We know it can increases your risk of pertussis B. We know that the studies are dangerous. We know that polio, this particular polio, we don't give to other countries because it's never been shown to protect you from polio, and it's not the one that they gave out in the sugar cubes in the 50s. Again, another rotavirus, another good PCB, and then you go in 2 months later. What are you going to get? I mean, the parents go into this absolute ignorant fallback. Okay, I got vaccinated. No human being on the planet has ever had this schedule. Okay, we're seeing the results of that. So realize that if you're on this schedule, you are an experiment. Okay, and all you got to do is look around at the health of our population. Now, the way you're supposed to be exposed to normal viruses, bacteria, funguses is through the nasal and oral mucosa. And this is what's called a Th1 response. Now, you need a robust, healthy gut flora. That means if you're not having something, or the healthy bacteria in your diet, healthy bacteria in your environment, or you're taking things that destroy your healthy gut flora, you're not going to be able to mount a healthy immune system response. So you need a healthy gut flora in order to maintain a healthy immune system. Now, a Th2 response, this is vaccine. This is acute damage. This is an acute inflammatory response. And this is why there's no humoral and cellular immunity. There's no beautiful cascade. This is an acute trauma that you get ready to fight something. And this is why we have a massive rise in inflammatory illnesses. And if you look at the rise in inflammatory illnesses, I mean, you're talking how many encephalitis, autism, irritable bowel conditions, okay, asthma, allergies. I mean, they got peanut-free days at the ballpark, for God's sake. So this is insane. Now, artificial sweeteners. So let's say we want to develop chemicals to sell to the public, and we're going to make them patentable. I want to bind chlorine onto a sugar molecule. I know what you're thinking. You're thinking, what a brilliant idea. By God, the body's going to taste that sweetness, but it's going to recognize the chlorine as toxic and poisonous and get it the hell out of the system, so you're not going to get any absorption. You're right. Don't bring that up. Yes, the chlorine molecule can break off and can cause really bad stuff. It can destroy the gut flora, so this means what's better, the pink stuff, the blue stuff at Starbucks? No. None. Go home, make some nice, healthy, organic coffee with healthy filtered water and use some organic sugar. Because this thing increases the pH level in your intestinal tract, making it not healthy for the healthy bacteria that you got. It reduces the amount of good bacteria. And I love this. Sucralose has a potent inhibitory effect on your gut bacteria and inactivates the digestive protease, which alters the gut barrier function, Journal of Toxicology. Now, when we look at this, antibiotics. Okay, now this is huge. If you're not taking them, if you're taking commercial animal products, you're getting them. But of the 154 million prescriptions for antibiotics written in doctors' offices, the CDC says 30% of those are unnecessary. So we're talking 50 million. 50 million prescriptions are totally unnecessary. Of those, 44% of the outpatient antibiotic prescriptions were written to treat acute respiratory conditions, which there is no absolute benefit whatsoever. It's nuts. But when you go to a medical doctor, the leading cause of death in America, and they give you, they diagnose your symptoms, and they look up that book, and they say, well, gee, you have an ear infection and bronchitis and a sinus infection, and I'm not supposed to give you any drugs. But I have no knowledge of nutrition or anatomy or physiology, so I'm not going to recommend high-dose vitamin C. So all I can really do to get paid from you and your insurance company is to prescribe you a drug that's worthless. And in fact, it actually increases your risk of cancer and damage. Welcome to America, okay? Or you can run a concentrated animal feeding operation, okay? And this is where 70% of the antibiotics are used. So if you're eating commercial meats, this is not good for you. Now, the effect of antibiotics, anti means against, bio means life. Okay, now so we have something that's a poisonous mold that's against life. Now, it can kill both beneficial and pathologic bacteria. This is why we have MRSA infections and antibiotic-resistant bacteria. But yeast, huge problem with yeast and Candida and molds because of the high antibiotics in our system. And this literally causes that leaky gut where you get, instead of the food going down the esophagus to the stomach to the jejunum, the ileum, the jejunum and ileum start to develop holes, and you get undigested proteins, undigested fats floating around in the system, and then that causes increased allergies, increased inflammation. It's devastating. Glyphosates, now this is in every bread product, it's in every wheat product that's not organic. This stuff is psychotic. It's a very powerful selective antibiotic. Okay, now we're talking, EPA is talking between 40 and 800 times the antibiotic threshold concentrations shown in clinical studies to damage mammalian tissue. So do not give this to the local whale. Don't give it to the local dolphin, okay? I don't know why our government says it's okay, but I know Hillary is being promoted by Monsanto, so she's going to get in, so don't worry. Okay, now the EPA is saying, and the U.S. Department of Agriculture is saying processed, slow-release, pesticide-laden gluten causes, what does it cause? Intestinal permeability, leaky gut, imbalance of the gut bacteria. That sounds like setting up for SIBO. Immune activation and allergic response. That sounds like it's getting more of an allergic or an inflammatory response to abnormal proteins. Impaired digestion and damage to the intestinal wall. And this is in almost every packaged product. Now, what type of medications negatively affect that gut flora? Because remember, we're talking about vaccinations, medications, antibiotics. Antibiotics are one of the medications, antacids, birth control pills. Yeah, estrogen is not good for you. Steroids, non-steroidal anti-inflammatories. How about occasional Advil, Motrin, Aleve? Okay, all of those disrupt the normal gut flora. Antidepressants. Well, yeah, if you got a gut issue, you're sad, so you got to take these. Statins, okay, cholesterol-lowering drugs. Why would that do it? My God, your body makes every glucocorticosteroid, mineralocorticosteroid, and sex hormone out of cholesterol. To take a drug to lower it is absolutely ignorant. Now, when we look at this, the keys to healing, we're talking about the nervous system because it controls everything, exercise because it moves everything. What you put in your system means something, and sleep and prayer and meditation. So where does this come from? You've got this automatic nervous system, and you've got this vagus nerve. No, whatever happens in Vegas doesn't stay in Vegas. We're talking about something totally different. Jeez, the crowd you got here. Okay, so you got this esophagus that comes down, and this vagus nerve goes on the front and the back of the esophagus and follows it down to innervate it. Now, I'm not kidding, okay, because this was kind of fun when I was teaching anatomy. They had an operation called a vagotomy, okay, where they cut the vagus nerve. Now, this is for people with really, really bad indigestion, and they cut it. And it felt really good. They didn't have that. Of course, they developed a shitload of other problems, okay? You know, because it kind of does a lot of different stuff. You know, it pretty much is the peristaltic action of the entire intestinal tract. And it's, I mean, I know, mind-boggling. Now, the vagus runs close to, it comes out of the brain right around that top bone of the neck. So any subluxations, you know, what do they call it? Tech neck, okay, all of that. Now, spinal misalignments in any of these regions can lead to neurologic compromise and altered digestive function. Why? Because you've got to look at the nervous system first. Parasympathetic is also called the rest, digest, and repair. Sympathetic is the fight or flight. And when we know that stress can alter this through the journal articles that we're looking at, by God, you've got to have the system balanced. If you're under a parasympathetic control, this stimulates peristalsis. Remember they were talking about slow gastric motility? It stimulates the release of bile. What does the sympathetic do? It slows down that gastric motility. I mean, so if decreased gastric motility is part of the symptoms and part of the cause, let's look at what controls the gastric motility. Was that too complicated? Okay, honest to God. Okay, now I want to show you what abnormal bowel gas looks like and what a normal bowel looks like. Now, she was actually diagnosed with ASIA, which is a bowel disorder, inflammatory response from vaccines. Okay, now you'll find out that because the federal government lied and falsified data, her claim was never accepted. But luckily she's doing good and she's healthy. Here's 2 kids. We're talking normal gut flora, abnormal gut flora. No vaccines, vaccines. Okay, this is your drug, this is your brain on drugs. Okay, remember the frying egg in the frying pan? I mean, it's just so common now. Now, so how do we rebuild the intestinal tract? Well, first you get the nervous system working right. And then we got to repair the intestinal lining and ease off the inflammation. Get rid of the bacterial overgrowth by eating a diet rich in essential nutrients that your body hasn't been absorbing. And that kind of makes sense. So you got to avoid bad stuff. Processed food, GMOs. Why? Because GMOs are soaked in glyphosates. Grains, particularly the toxic ones that are soaked in glyphosates, artificial and processed sugars, pasteurized and homogenized dairy. Remember, we're training our bodies to be, or if you're vaccinated, you're training to respond with an inflammatory response. Pasteurized dairy is some of the sickest animals the world's ever seen. There's no way you'd want to drink the milk from these poor creatures because they're given hormones to maintain them being pregnant, because only pregnant animals give milk, and there's millions and millions of bacteria per liter. Okay, but don't worry about it. The pasteurization kills the bacteria. However, you got millions of dead bacteria in that liter of milk. I mean, raw organic milk, okay, has healthy bacteria. This stuff has got dead bacteria in there, which again causes an inflammatory response. And if it's even worse, if you got a leaky gut, you're getting those dead bacteria and the undigested proteins if it's homogenized, that means the beautiful, healthy fats are now shards of fat that can damage and cause inflammation. Unhealthy meat. Yep. It's better to eat the skunk that's roadkill, okay, than go to McDonald's. Okay, I'm telling you right now. Okay, unhealthy fats. The polyunsaturated fats, corn oil, canola oil, soy oil, flax oil unless it's freshly ground, cottonseed oil. Good God, nobody eats cotton plants except for cows. Okay, so those are all polyunsaturated fats that cause an inflammatory response. So don't eat that list, eat this list. Okay? I mean, it seems too simple. You get the nervous system working right. You get the small fish, anchovy, mackerel, sardines, green leafy vegetables, carrots, squash. I mean, cook this stuff up with a little sauteed of coconut oil, good God. And then for dessert, you toss a banana, some blueberries, some grapes, honeydew melon in the blender. You know, put a couple of frozen bananas in there and a little bit of spring water. Oh my God. Doesn't that sound good? And no, honey, this smoothie, I'm helping my gut flora. It's just like good. Okay, now gut and psychology syndrome, the GAPS diet. Okay, coconut oil, why? Because the rich, healthy fats help the brain function. Eat fruit in between meals, not with meals, and that kind of makes sense too. They call it, there's certain food combinings where you want that sweetness and that carbohydrate. Bone broth is excellent. Probiotic-rich foods, so this is fermented foods, kombucha, cultured vegetables, raw dairy, fermented dairy. Okay, I mean, it's fantastic. We got an advantage here. There's a farms called Fermentation Farms close by. Phenomenal. Now, supplements. Remember, we're missing the intestinal bacteria that produce certain vitamins. So we got to supplement with those until our intestinal bacteria get up and running. So vitamin B12, very common. Vitamin D, phenomenal for the immune system. Vitamin K, because our bacteria aren't producing it yet. Probiotics, digestive enzymes. And the probiotics, make sure it's not just one bacteria. Try and get one with multiple bacteria in there. Iron and zinc, and make sure the iron and zinc are in whole food form. Okay, because if you get fortified with iron, if you see that, it's literally iron ore. Do the experiment with fortified Cheerios and a magnet in water. It's a trip. I know. Okay, now sources for B12. You're talking raw cheese, sardines, animal sources, lamb, raw milk, eggs, wild salmon. When we look at vitamin D, sun is the best time, but we're getting out of the summertime going into fall here. Even at Huntington Beach, we're not going to get a lot of sunlight. So if your shadow is longer than your body, you're not getting enough. Or if you're working inside like me from 4 o'clock in the morning to, 8 o'clock tonight, okay, I'm not getting a lot of sun. So vitamin D supplementation is fantastic. And it should be 3,000 units for international units for every 100 pounds of body weight, and that's safe. Now, vitamin D and K2, they have a synergisticity where they work together. And K2 sources, again, are grass-fed animal products, butter, ghee, fermented foods, the cheese with a mold on it, like Goudas and Bries. Natural sources of vitamin K, dark green leafy vegetables. And if you are taking blood thinners, it's going to say, for God's sake, don't get dark green leafy vegetables because they have vitamin K, and vitamin K is involved in clotting. Now, any doctor that's really that ignorant, okay, because it's like saying orange juice is involved in immune system. For goodness sake, don't take any orange juice if you have an autoimmune condition. It's like, what? No, back away from that lettuce. For God's sake, it's going to clot your arteries, you damn vegetarian. Can you see how psychotic this is? We actually have a letter to give to the doctor that's giving the blood thinners to explain that dark green leafy vegetables, even though they have vitamin K, they're not going to clump your blood in your arteries and stroke you out. Honest to God. I mean, this is, what's that movie? The wrestler got elected president. Idiocracy. Yeah, we are now going into idiocracy. Okay, Brussels sprouts, cabbage, broccoli, fermented dairy again. And you're seeing this is like absolutely fantastic. Fermented foods, we've got several videos on how to ferment it, and it's so easy. You chop it up, cut it up, put it in a jar, put a little bit of spring water in there, leave it on the counter for about a week to 10 days until it starts to ferment. It's fantastic. Natural sources of iron. Now, beef liver, when we put these animal products up here, make sure that they are organic and healthy and not from a concentrated feedlot. Oysters, chickpeas. I mean, who wouldn't want a little bit of hummus? Hummus, lentils, dark green leafies, and chocolate. Yes, chocolate is a good source. Natural sources of zinc, kefir, yogurt, again with the chickpeas and hummus. Oh my gosh. Pumpkin seeds. They got chocolate-covered organic pumpkin seeds with 70% dark organic cacao at Whole Wallet Market. Okay, mushrooms, Whole Foods. Okay, sorry. So this is literally how you fix it. Doesn't it make sense? And it's super simple, but it's almost like you're listening to what your body's doing. Now, we got it on the handout, basic supplements, and it's pretty much the same chart. Death and health neither have symptoms. And every time you make a decision, you're either going towards one or away from the other. It's really simple. You can screw up a little bit, you can screw up occasionally, you don't need to be obsessed about this. But the more good you do in your life, the healthier your life is going to be. And it's just, I get people all the time saying, well, for God's sake, I couldn't sleep this weekend. I said, that's okay, you can sleep now. Go back to the sleep thing. Or I went to a birthday party, and I get this all the time. One of our patients had Crohn's disease, and she's only 8 years old, and she lives back east, like up in Chicago area, and she had a birthday cake. Okay, wiped her out, made her upset, diarrhea, and I said, no problem, get some water, get some fermented veggies, and she's fine. So do more good stuff than bad stuff. Welcome to True Health Tuesdays. Okay, we're talking about Candida, and you're going to find out why Candida, and I know it's got a really bad rep, why it's actually kind of cool, and other fungi. Now, okay, so this mushroom walks into this bar. Mushroom sits down at the bar, and the bartender says, no, we don't serve your kind here. He said, why? I'm a fun guy. Okay, so... So let's look at this. Okay, what's the big deal about Candida? Okay, now you're going to find out it's got a diamyphore. It's in two parts. Okay, it is a yeast. It can turn into a fungus, and when it gets a fungus, that's when it's dangerous. But it's linked to a number of different conditions. So we're talking not just headaches and sinus problems. We're talking chronic fatigue, fibromyalgia, skin issues, sexual dysfunction, irritable bowel syndrome, autism, cancers. The interesting thing with cancers and fungus is I agree with the guy's data as well, and autoimmune diseases. Now, when did all this start? You can trace it back to the very first book. The Yeast Connection by Dr. Crook, interesting name, wrote the first edition in 1986. And what he did, he correlated candidiasis or candida hypersensitization. So everybody does have candida. We all do. We all have different funguses. And you're going to find out that it's not really an issue. In fact, we need the candida in our system to feed certain bacterias. Now, so it's a hypersensitivity, and he was linking it to fatigue, sexual dysfunction. Well, there was another article in Huffington Post by Kim Evans, and she's claiming 90% of the population, okay, of the U.S. population has a candida overgrowth problem. And when you start looking at this, it's like, really, what's causing that? You know, why is fungus affecting our population, okay, and yeast to such a great extent? Well, Dr. Simoncini, he actually has a number of studies where he is proving that a lot of cancers are fungal in origin, where you can actually treat it with baking soda, as simple as that is. But it's, again, an advanced overgrowth of candida. So Candidiasis is a fungal infection caused by yeast that belong to the genus Candida. And this is right out of the CDC. There's over 20 species of Candida yeast that can cause infection in humans. The most common is Candida albicans. Candida yeast normally live on the skin and mucous membranes without causing infections. Wait a second. So Candida is actually part of our normal flora. It lives on the mucous membranes. So now you start thinking, well, what's the deal? Why does it cause it? Now, there's a number of different kinds, because if it starts to overgrow or if it starts to negatively affect the body, you're talking thrush, that's in the oral pharynx, esophageal, vaginal yeast infections, super common, invasive candidiasis, where it can actually get really nasty. Now, some of the symptoms of thrush, and this, I mean, we've seen it in almost every bottle-fed kid that comes in here, because the kids are poisoned. Redness or soreness, difficulty in swallowing, cracking at the corners of the mouth is super common. So now, if it's normal flora for those areas, what's causing it to overgrow? Now this is the most common of the yeast infections. Genital itching, burnings, cottage cheese-like vaginal discharge, yuck. Men with genital candidiasis may experience an itchy rash on the penis. None of that sounds like fun. Okay, now the global emergence, and this is interesting too, because when we talk about antibiotic resistant bacteria, who caused it? We did. Okay, we did, because what happens is the more potent that you try and kill a living substance, only the stronger ones survive. It's the same thing with funguses and yeasts. We actually need to live in harmony with them. Candida auris. Healthcare facilities, okay, so what are they doing? They're disinfecting all the time. In several countries reported that a type of yeast called Candida auris has caused several illnesses in hospitalized patients. This yeast often does not respond to commonly used antifungal drugs, making infections difficult to treat. And so it's the same kind of deal where we're treating it. So let's look at some of the different funguses that are causing the diseases. And this is just a partial list. So aspergillosis, blastomycosis, valley fever, neoformans, cryptococcus, histoplasmosis, mucormycosis, pneumocystis pneumoniae, sporotrichosis. We're looking at Clostridium sporinium, cladosporidium, ringworm. I mean, all of these. So it's not just one, it's a number of different funguses that can cause diseases. So why is Candida more popular than the others, or more prevalent? Well, it's the only one that lives on our skin and in our mucous membranes. So it is normal flora. And I love this out of the CDC. Very rarely do you get actually, really good information from the CDC. Now, fungi are everywhere. 1.5 million species live on Earth, but only 300 of those species are known to cause diseases. Fungal diseases that often caused by fungi are common in the environment. Now, fungi live outdoors, in the soil, plants, trees, indoor surfaces, and most everything is not dangerous. In fact, none of it is dangerous if you have a healthy immune system. Like if you've heard of black mold, okay, you're going to find out that that's not dangerous unless you have a weakened immune system. So let's go down the list, okay, just a bit. Aspergillosis is an infection caused by Aspergillus, a common mold. Now this mold lives indoors, outdoors. People breathe in the spores. And most everybody does it without getting sick. So, and again, according to the CDC, people with weakened immune systems do. They can get sick. Now, wait a second. So it's normal. So the average person with a normal, healthy immune system can breathe mold spores in, fungal spores in, and not get sick. Cryptococcus neoformans, fungus that lives in the environment throughout the world. People can become infected after breathing in the microscopic fungus, although most people who are exposed to the fungus never get sick. It only occurs in a weakened immune system. And you're going to see this over and over and over again. Now, histoplasmosis, again, breathing in the microscopic fungal spores through the air. Most everybody breathes in the spores, they don't get sick. What is it? A weakened immune system. So we have that normal, not resistance, but it's actually part of our environment. Pneumocystis pneumoniae, serious illness caused by fungus, and this is from very, very weakened immune systems. It's one of the most frequent and severe opportunistic infections, but only in people with what? Weakened immune systems. So you start to think, okay, well, if everybody breathes it in and only the people with weakened immune systems are getting this. Fungi are the most common environment, and people breathe in or come in contact with fungal spores every day without getting sick. However, people with weakened immune systems. So it's not the funguses that are causing this. It's the weakened immune system. Does that make sense? So now what causes fungal infections? Things that weaken the immune system. Chemotherapy, hospitalizations, and medications. And I love this. Chemotherapy and radiation cause many changes in the body. One major change is these treatments weaken the immune system, increasing your risk of getting fungal infections. And it's interesting, too, because they use chemotherapy and radiation for what's most common? Cancers. And what does Simoncini correlate them with? Fungal infections. And this increases fungal infections. Could this be why chemotherapy is generally only 2% effective? Reading that backwards, it's 98% not effective? I know, it's insane. Okay, now even according to the CDC, they say hospitalizations are dangerous. Even though you're staying in a hospital to get better, it's possible to get an infection when you're there. Yeah, that's called iatrogenic. If you're staying in a hospital for an injury or illness, you may get sick or get at risk of a fungal infection, especially if you have a weakened immune system. Yeah, hospitals are not a place to get healthy. Medications, and we're going to cover this, okay, the list of medications that cause a weakening of the immune system, and it's insane because, well, I'll relay a case today that came in, multiple prescriptions. Most serious fungal infections are rare, but they happen when weakened immune systems. Specifically, steroids and tumor necrosis factor inhibitors are two types of medications that massively raise up the risk of fungal infections. Steroids, super common. And we're talking, this is just like a small list of some of the steroids or medications. You're talking cortisone, hydrocortisone, prednisolone. I mean, this is a list of oral corticosteroids that are devastating. I mean, we're not just talking fungal infections, but it weakens the entire immune system. And they give them for so many things. I mean, you could have a minor amount of swelling, you could have a skin issue, you could have anything, and they give these drugs, even though it can lead to a secondary fungal infection. It's mind-boggling. Inhaled steroids. Okay, this not only oral thrush, but I mean, the patient I got today was taking Advair and Symbicort, or Quavir. She's taken 3 different medications for asthma. And I said, well, why don't we fix it? She says, well, I've had it for 30 years. Okay, asthma's not a problem of the lungs. Let's fix it. It's a problem with the smooth muscle control of the lungs. We'll get you healthy. And she really didn't even think that she could possibly get better. And guess what other things she had? You know, chronic Candida. She was exposed to black mold. And this is all the things that she was feeling was cause of her problem. It's not. And I love this, tumor necrosis factor inhibitors. Serious fungal infections, particularly histoplasmosis. I mean, when you look at the commercials, and you've seen it, you know, try Humira, you know, for those really nasty autoimmune diseases. Of course, you can get a nasty fungal infections, which will cause a leaky gut and lead to autoimmune conditions and cause swelling. I mean, it's literally, I love the picture here. It's like putting a bomb in the middle of these drugs. Yeah, take this. It's going to blow holes in your intestinal tract. It's going to weaken your immune system horribly. There's just no rhyme or reason to prescribe this stuff. Now, these are the antifungal drugs, and I know we just read that the antifungal drugs cause increase in fungal infections. Okay? So we have, and this is how it's listed, Tier 1 and Tier 2. Now, and they start from really bad to ridiculously stupidly bad to horribly bad to absolute, it's going to kill you. So we're going to go over these side effects, because remember the multiple effects of Candida and other fungal and yeast? Well, how would you like to take this with the antifungal drugs? Itching, hives, unpleasant sensation, difficulty in breathing, closing of your throat, swelling of your lips and tongue, severe blisters, lips redness. How do you know if you're getting over the Candida or being attacked by the fungal, or it's a side effect of the drug? But don't buy yet. Let's try this Terbinafine. Okay, headache, dizziness, skin rash, unpleasant odor, joint pain, swelling of the glands, changes in mood behavior, hearing problems, weight loss, raised flaky skin, fever, rash, sore throat. Let's try this other one, because we're developing too many symptoms from that last drug. Let's try this drug. Don't worry, we have headaches, unpleasant taste, stomach pain, itching, loss of appetite, severe blistering, peeling, and red rash of skin. What were the signs of? Okay, seizures, convulsions. I love this one. Severe depression, confusion, thoughts of hurting yourself. Now, why would this be? Why would an antifungal drug, something that's killing fungals, cause massive mood fluctuations? Could it be that it's actually destroying some of our normal gut and where serotonin is produced and stored? Could it be negatively affecting the enteric brain or neurotransmitters? Yes, absolutely. Again, we're getting into the Tier 2 ones, which are even scarier. Nausea, vomiting, headaches, sleep problems, chest pain, pounding heart rate, low potassium, confusion, extreme thirst, increased urination, swelling, rapid weight gain, pale skin, rapid heart rate, trouble concentrating, muscle pain, weakness. Now, finally, some good information from the CDC. Just like some bacterial infections are resistant to antibiotics, some fungi no longer respond to antifungal medications. Yeah, because we use them all the time and it's getting stronger and stronger. So it's known as antifungal resistance. Now, some species of fungi are naturally resistant to certain types of antifungal medications. Other species may be normally susceptible to a particular type of medication, but develop resistance over time as a result of improper antifungal use. Now, wouldn't it be cool? And I'm just saying this for shits and giggles. Imagine if we had antifungals that had no side effects other than health. That Candida, black mold, all that stuff was eliminated. Sounds like a crazy world, isn't it? I know, stay tuned, okay? Okay, antibiotic resistance. Okay, now, anybody know the story of the first antibiotic? Okay, this guy, he's eating a sandwich in his lab, okay, really sanitary conditions. He's got some petri dishes of bacteria. Piece of the bread falls off of his sandwich, gets in the petri dish, he goes away for the weekend, comes back Monday. There's mold around it, around his bread, and he notices all the bacteria around the mold are dead. And he thought, hey, poisonous mold. It's against life. Let's call it an antibiotic. Okay, bio means life. Anti means against life. So cool, we're going to do this whole class of drugs called antibiotics, and they're generally poisonous molds. Were you aware of that? I know, inquiring minds want to know. Okay, so when we look at this, some studies indicate that antibacterial medications may contribute to fungal resistance. This could also occur for a variety of reasons. One of which is that antibacterials reduce bacteria in the gut, creating favorable conditions for Candida growth. You see, Candida are amazing. In fact, bacteria feed on Candida. They feed on the yeast. In the funguses and yeast that we have in our mucous membranes actually help break down some of this. So anytime we try and go in there and disrupt the normal flora, we're disrupting the normal environment. It's not yet known if decreasing the use of all or certain antimicrobial agents can reduce Candida infections, but appropriate use of antibacterial and antifungal agents is one of the most important factors in fighting drug resistance. Okay, thank goodness that the CDC is now astounding stupid again, because they had really, really good information. It gets kind of confused, but they keep going at the medication thing instead of the real story. I mean, even on their site, they say about half of all prescriptions for antibiotics are toxic and useless. And you're talking over 262 million prescriptions. Okay, and that's in America, that's not worldwide. Now, so why are antibiotics so harmful? Well, first, they kill both beneficial and pathologic bacteria. They kill everything, rapidly changing. It's called dysbiosis, totally changes the microflora. Now, yeasts are opportunistic. When yeast change, okay, and they become fungi, they develop these little, they're called hyphae. And if you've ever heard of leaky gut, these little tiny strings bore holes into it. So just think of if you've ever seen mold, okay, that's permeating drywall or carpet or anything. What's it look like? It looks like little fimbriae or strings sticking in the wall, and it's boring holes in the drywall or through the wood. This bores holes in the intestinal tract. So, and this is where the leaky gut happens. This is where systemic inflammation, this is the deadly part. God, it'd be cool if there was a natural substance that would kill hyphae. Stay tuned. I know, it's right on the edge. Okay, so no, I don't take antibiotics, but let's go to McDonald's for lunch. Okay, here you go, concentrating feeding operations. Concentrated animal feeding operations. These things are incredible for spreading antibiotic resistant, loaded with antibiotics. You can't eat the meat in this country unless it's organic, grass-fed, and natural. They don't have this type of meat in Europe, so you guys are okay. In Canada, I think you're still screwed. Okay. Yeah, but Canada's basically cooler than here. Okay, glyphosates. Okay, this is in almost every grain. It's it's in almost every food product. It's now drifting into most water sources. We just had this sweet couple from Iowa, and they're surrounded by cornfields. And of course, what do they have? Dysbiosis. And it's so frustrating because, we're doomed to repeat what we don't learn. Okay, does that make sense? Okay, so like the Mayan civilizations was wiped out because of a drought. They used up all their water. You're going to see multiple civilizations just dying off because they're using up their resources. So we now know that if we use too many antibiotics, we create antibiotic-resistant stuff. If we use too many antifungals, we keep fungal-resistant stuff. If we use too many herbicides, we create weeds that are devastating because only these massive weeds that are, breaking down combines and everything else are growing, and there's nothing more there to do. Okay, instead of working with nature, we're trying to master it, and it's literally killing us. Now, what kind of medications disrupt the normal flora? Because again, it's people with weakened immune systems, so what kind of things can cause that? Antibiotics, yeah. Anti means against, bio means life. So we have poisonous molds, yeah, of course, we're going to give that to you. If you have a life-threatening illness, take it. But for God's sake, if you got a common cold or a sinus infection or an ear infection, those things are not only not recommended, if the doctor's prescribing it, he's either ignorant or an idiot. Wait, now that's... Well, yeah. Antacids. That's insane. We need acid in the stomach to control bacteria and fungal growth of the stuff we take in. And reflux doesn't come from too much acid, it comes from too little. Birth control pills, no problem. Take those, you develop a little bit of cottage cheese yeast infection, birth control done. Steroids. I can't believe I said that. I'm so sorry to all women in the world. Okay. Steroids, okay? Non-steroidal anti-inflammatories. I had a great conversation with an oncologist. Okay, one of our patients, super, super cool guy. His dad's an oncologist, his mom was in the room, and he wanted me to explain what we do, with altering the autonomic nervous system to get the body healthy. So I had a really nice conversation with him. And, I can't help notice it, but his mom has got these massive bunion formations. And I said, let me give you an example of what we do. Right now, your sweetheart there has got weak intrinsic muscles of the foot. This indicates that the nerves that supply the foot, are damaged. Those nerves come out of the pelvis. That means she has an unstable pelvis. She's going to have bowel and bladder control issues, possible leg issues. But what would you do, doc? You would prescribe a non-steroidal anti-inflammatory, that destroys the normal joint cartilage, proteoglycan production, and increases the risk for certain infections. And then they go crazy because they say, yeah, Mom, you can't even stand up for, more than 4 minutes because your legs go numb. You know what she says? I'm fine. I'm fine. All I got to do is just walk around, and then I'm fine. I'm fine. Antidepressants are good in that case, but it may weaken the immune system. Statin drugs, oh yeah, cholesterol drugs, that's brilliant, okay? We're going to lower cholesterol, the building product of every glucocorticosteroid, methyl-corticosteroid, sex hormone, progesterone, estrogen, testosterone, the building product of everything that keeps you alive, we're going to lower it with a cholesterol drug. Brilliant. Okay, that was sarcasm, by the way. Okay, so importance of microflora. You have a 10-to-1. You have 70 trillion cells in your body. You have 10 times that bacteria. We need the good bacteria. We need it. We should be bathing in this stuff. In fact, if you start looking at this, how many people are using antibacterial soap? It's psychotic because that literally is killing the normal flora on the skin. We need healthy bacteria on the skin and in our gut, in our mouth. We have bacteria on our eyes. We have it everywhere. Viruses, and I love this. If instead of we had virophobia or bacteriophobia, you get all these commercials on killing germs. No, it's not the germs. Even Pasteur was the pasteurization process. He kept on arguing it's the germs that cause it, germs that cause it. And contemporary his name, Beauchamp, said no, it's the terrain, where we're surrounded by bacteria, viruses, funguses, molds, bacteria, everything else. So it's not the pathogen, it's the immune system. Had a great discussion with a doctor last week. And we were almost coming to blows, because I was saying, Pasteur and Beauchamp, even Pasteur recounted on his deathbed that no, it's the terrain, as legend goes. I wasn't there. Okay, I'm not that old, Heidi, just settle down. Okay, but you start seeing this and you think, my God, could it be that we have a harmonious relationship in our world, in our environment with this stuff, and instead of being psychotically phobic, that Nobel Prize winner. Humans are well over 50% viral. It makes more sense. It just does, because we're designed to live here. So what's the function of this? What's the function of normal flora? So now also too, when you look at this, we're talking digestion, absorption of carbohydrates, production of vitamins, absorption of minerals, eliminates toxins, distinguishes between pathogens, harmful, non-harmful, keeps harmful bacteria under control, aid in production of antibodies to pathogens, supports the immune system. Now we move to Iowa. We're surrounded by cornfields that are soaked in glyphosates. It gets in our water system. We lose this ability. Think of that. That just doesn't make any sense. So what causes fungal infections? What does the CDC, what does everybody say? What did Pasteur recount on his deathbed? A weakened immune system, it's the terrain. Okay, medications, particularly the poisonous molds, the antibiotics. Chemotherapy, okay, and that's toxic chemotherapy, not because you could call vitamin C, chemotherapy as well. Toxic food, especially meats from the concentrating animal feeding operations, and an unhealthy microflora, absolutely. So what do? How do we build our immune system? Well, organic plant-based diet, as simple as that seems. It seems, so the people that come in who are toxic, what do we tell them? Yeah, plant-based diet. It sounds crazy, but it really is that simple. Healthy saturated fats like coconut oil, fermented veggies, probiotics. And the probiotics, try and get healthy probiotics. Because what does that do? That actually gets healthy bacteria in your system. You're taking bacteria in, and then fermented foods. Look at all the different fermentation that you can get in there. Juiced vegetables, blended fruits, raw dairy, animal fat-based omega-3s. It's so simple to get fermented foods. But if you're going to, say, the shelf at the standard supermarket and getting sauerkraut that's already been pasteurized and preserved, that is not living food. Make it. It's super simple. Miso, kimchi. Now, this one, black seed oil, is biblical. This is in the Bible, the Quran, the Torah. It's brilliant. Now, not only over 800 peer-reviewed studies, antibacterial, anti-inflammatory, antifungal, antioxidant. So now it's pretty good, 800 peer-reviewed studies. Let's see if they see anything directly with fungal infections. Oh my gosh, Nigella sativa, which is the black seed oil, inhibitory effect against Candidiasis. This study validates traditional use of the plant in fungal infections. Okay, confirms the potential antioxidant and antimicrobial of Nigella sativa, which can be considered not only as a dietary supplement, but being used as a variety of free radical-induced damage diseases. Wait a second, it's non-toxic. It's effective. It kills this stuff, and it's natural. No, it can't be that simple. See, the CDC is saying weaken immune system, weaken immune system, weaken immune system, but we're so damn stupid, all we understand is drugs. We can't look at plant products because our bosses, the pharmaceutical industry, aren't paying us to promote that. Turmeric, anti-inflammatory, antimicrobial, antioxidant, anti-neoplastic, which is anti-cancer properties. No kidding, turmeric and fungal infections. I love this. Curcumin, by its antioxidant activity level, showed neuroprotection against the 3 NP-induced behavior and biochemical alterations. It's a fungal toxin. A present study investigated the antifungal effects of natural polyphenol, or curcumin, against albicans, non-albicans species of Candida, showed its ability to inhibit the growth of all tested strains. Our results provide the first evidence that curcumin acts as an antifungal agent via generation of oxidative stress and inhibits the hyphae development. Wait a second. Ow, my brain just hurt. So you mean the thing that bores holes in the intestinal tract, causing leaky gut, that thing that's a projection, that this destroys the ability of yeast that turn into fungus, that bore holes in the intestinal tract, and it tastes great. Honest to goodness, we tell people to get some root vegetable juices, put some turmeric root in there. About a tablespoon or 2 is therapeutic dose. European Journal of Pharmacology, curcumin's potent antifungal activity against different strains of Candida, Cryptococcus, Aspergillus, Trichosporon, and Paracoccocytides have been reported. Aim of this review is to discuss curcumin's dual pharmacological activities regarding its application as a natural anti-cancer and antifungal agent. CDC, you're asleep at the switch, man. Okay? Weaken immune system, all we got to do, strengthen the immune system. It seems too simple. Vitamin D exerts important regulatory functions on cells from the innate as well as from the adaptive immune system response. Indeed, accumulated evidence has shown insufficient vitamin D levels may lead to dysregulation of the immune system responses, thus contributing to autoimmune diseases. So this means vitamin D is good. Okay, at this time of the year, we're in October. Even though we're in sunny Southern California, we don't get enough sunlight at this time of the year. So even we have to supplement now. It's benign. It's good for you. You're not going to get sick from it. What does the asthma research and practice say? Vitamin D supplementation decreases Aspergillus fumigatus, specifically Th2 responses in cystic fibrosis patients with Aspergillus sensitization. These are severely injured people with severely damaged lungs. Okay, and Th2, if you'll remember, that's the inflammatory response caused by vaccinations or an acute inflammatory state. It helps with that, vitamin D. Okay, so what are the exposures? 20 minutes a day in the normal sunlight. If not, you got to be supplementing. 3,000 units for every 100 pounds of body weight. 8 to 10,000 is normally inappropriate. If you have a cold, 50,000 for 5 days is appropriate. Dr. McCullough, I think, recommends 100,000 units for 7 days if you have a cold or flu or an immune system response. It's just essential. But what do you need with vitamin D? You need vitamin K2. Okay, so what are the food sources of this? Grass-fed organic animal products, fermented foods, certain cheeses, brie, Gouda. Come on, get a little fresh sauerkraut, put a little brie on it. No, honey, I'm getting my K2 and my bacteria. I'm not just partying. Breastfeeding. It's not just for men anymore. Okay, I didn't just say that, did I? We're supposed to have this filter. Okay, so when you look at this, I mean, real breastfeeding. Serum from breastfed infants induces a greater phagocytic capacity against Candida albicans. Phago means eating, cytic means cells. It means that this stuff actually kills the fungus from real breastfeeding. But what's interesting, it's formula versus breastfeeding. And if you're measuring the formula-fed infants, they have a greater, they don't have the resistance because it's toxic. I mean, you figure most of the formulas now are genetically modified soy and sugar, and then we wonder why the kid gets up with thrush. This is interesting. Determine the occurrence of Candida in the oral cavity, predominantly breastfed infants in their mother's mouths and breasts, as the oral cavity bottle-fed infants. So this is checking the actual child sucking the breast versus the child sucking the bottle. It turns out that there's healthy bacteria around that breast, and it's good for the child. I mean, amazing. Clove and fungal infections. Clove oil may suppress the growth of Candida albicans. It's clear the clove oil shows powerful antifungal activities. Garlic. God bless garlic. The ubiquitous opportunistic pathogen Candida albicans is sensitive to garlic. Resistant to the broad spectrum of active principles present is unlikely, so that its anti-candidal effects may provide an important alternative route to chemotherapy. No kidding. Think of this. Okay, the aqueous garlic extract, 133 multiple drug-resistant gram-positive and gram-negative. Gram-negative bacteria you do not want. Okay, isolates. And against 10 Candida were studied. The results of the study support the use of garlic in health products and herbal remedies. I mean, it just makes sense. It's true, my mom broke up with a guy because he didn't like garlic. Honestly, I mean, she said there were other reasons, but then the last was the straw, and he doesn't like garlic. Okay, it's you guys should have met my mom. She was cool. Okay, antifungal essential oils. Clove, tea tree oil. Now, some of these can be used internally, some of them topically. Believe me, you don't want to use oregano oil topically. It burns, okay? Or you can cut it with something. Lemongrass, cinnamon bark, thyme, lavender, geranium, chamomile, cassia. When we look at antifungal foods, spices, I mean, this is just stuff you should add to your normal repertoire of what you eat. I mean, I love that picture. That's real food. Turmeric, curcumin, black seed, garlic, apple cider vinegar, coconut oil, cinnamon. I mean, it seems too simple that we just put healthy food and healthy bacteria, and you could reverse black mold. You could reverse everything. So when we talk about the 5 keys of health, and we talk about how important the nervous system is, why? Because it's not what's attacking you, it's the terrain. And the nervous system controls and coordinates not only the immune system, it controls the hormonal system, it controls and coordinates every function of the body. You gotta have this thing checked. Regular exercise, why? Because it strengthens the immune system. What do they keep on saying? Weaken immune system, weaken immune system, weaken immune system. Exercise a half hour a day strengthens it. Proper nutrition, this means normal, healthy, organic food. Plant-based diet. I mean, that's just normal. Sufficient rest. Why? Because if you don't get sufficient rest, your immune system is weakened. This is why if you're getting deep sleep and you're sleeping where there is black mold and you eat healthy and you have a good proper nervous system and you exercise regularly and have prayer and meditation, you won't get any negative effects from it. Honest to goodness. I mean, I know it sounds weird, but the last place I was staying, I moved off of my boat into this little apartment. And they had a huge water leak. You know, cleaned up everything as best we could. But when I moved, I took the bed, you know, the headboard off, and it like stuck to the back wall, and it was ripped. It was just tons of black mold back there. And I thought, wow, I don't have it. Because I'm always getting people who say, oh, man, I had black mold when I was 12, you know, and 65 now, and it's been affecting me my whole life. You know, I think, no, that's not possible, you know? Let's strengthen your immune system, detox your system, you're going to be fine. And prayer and meditation. I mean, and then for reference, on top of reference, on top of reference. I mean, it just makes sense. We're designed to live in this environment. Don't be afraid of Candida. Don't be afraid of yeast. Don't be afraid of mold. You know, be afraid of the psychotic drugs that we're giving, okay, and the drugs in the food, because we're smart. Now, any questions? Yes, sir.
Yes, my question is in regards to your microbiome, like your gut flora.
Yes.
So let's say you take an antibiotic, which goes in and destroys all forms of bacteria in there. Is it possible to get your original states back?
Oh yeah, absolutely, very quickly. And They call it Montezuma's Revenge, where if you're from Southern California, because we're right next to the border in Mexico, if you go across the border, you eat the food over there or the water, you're supposed to get diarrhea. Okay? That is a change in normal flora. If you're coming from Mexico up to LA, which the water is way more poisonous, okay, that they will get diarrhea and upset stomach as well, because they're changing normal flora. So anytime you move to a different area, there's a different normal flora in that area. So there typically is going to be a little bit of diarrhea, a little bit of change. So what you want to do, if you have been poisoned by an antibiotic, fire the doctor. That would be a good idea, because you didn't have a life-threatening illness. Okay, and prepare the environment by taking probiotics. Okay, because that's going to change the acidity of the environment in order to accept the new bacteria in the area that you are. And then try and get some locally fermented foods, locally fermented cheeses, and put a little brie on the sauerkraut and enjoy. Yeah, you'll repopulate it quickly. And plus do the raw organic root vegetable juices. Phenomenal, because root vegetable juices are going to have tons of bacteria on there. And since root vegetables grow in a moist environment, they have anti-mold properties. It's pretty cool. Any other questions? Yes, ma'am.
You quickly went by baking soda, and then you went on, tell me more about baking soda.
Oh, this is the interesting thing, because if you're like washing with a very, very alkaline solution, okay, like doing a douche with baking soda or washing, areas, that is actually negative, because it can create an opportunistic environment for molds and yeasts and funguses to grow. What Dr. Simoncini did, okay, and this is really interesting, if you expose mold directly to baking soda or to something that's very, very alkaline, it'll kill it. And so he'll hook up like a 5% solution of saline water and sodium bicarb to tumors. And he's got pre and post that shows them eliminated, which is just brilliant, amazing, and non-toxic, but not many people have really incorporated it. But don't use it topically for anything else. Okay, because it can create a competitive environment, even though you're directly putting it on some type of mold and can kill the mold, but you don't want to wash areas that are predisposed to having Candida albicans or some other type of mold or fungus, because you have a weakened immune system. Okay, does that make sense? Okay, and next week, it's really exciting. Acne, eczema, and other skin diseases. God, what a fun month. Thank you very much.